Hello everyone. So welcome back to our next recall session. So today we're going to discuss with you about the anatomy recall questions of NEET-PG 2019. So let us start discussing the questions. The first question is, the movements at the V joint permit a person to look to the right and left. So this is actually the no movement. To look to the right and left is the no movement. So no movement is actually possible at atlantoaxial joint. So the answer here is B, atlantoaxial joint. The next question is, all of the following are true about the right coronary artery except. So let us see the statements. Its diameter is less than left coronary artery. This one is true. It arises from the anterior aortic sinus. This one is also true. It gives rise to circumflex coronary branch. This one is false, because the circumflex coronary branch is the branch given by left coronary artery instead of right coronary artery. And the last statement is right coronal artery is its first branch. This one is true statement. So the answer here is C, that is the false statement. The next question is, what is the basis for the formation of omphalocele? Excessive length of intestine? No, that is false. Physiological hernia failing to go back? This is a completely true statement. This is actually the basis of formation of omphalocele. Herniation of liver? No, it is false. And herniation of umbilicus? This one is also false. So the answer here is B. The physiological hernia failing to go back. That is the basis for the formation of omphalocele. The next question is, which fiber marked by the arrow in the image shown below? This is actually the internal capsule. And the fibers that is present in the internal capsule is projection fibers. So the answer here is C, projection fibers. The next question is, which nerve passes through the foramen marked in the image below? So the marked foramen is mandibular foramen. And the nerve that passed through mandibular foramen is inferior alveolar nerve. So the answer here is D, inferior alveolar nerve. The next question is, boundaries of calotte triangle are formed by all except. So let us discuss the boundaries of the calotte triangle. Medially, it is formed by common hepatic duct. Inferiorly, It is formed by cystic duct, and superiorly it is formed by cystic artery. So the answer here is D, gallbladder. Gallbladder cannot form the boundary of the Galois triangle. So the next question is, the area marked in the given image is supplied by dermatome number. So we have to first label this dermatome. This one is 1, 2, 3, 4, 5, 6, 7, 8, 9 and 10. So this one is supplied by T10 dermatome. T1 to T10, this one is 11 and this one is 12. So this area is supplied by T10 dermatome. This is the umbilical area. The next question is, the arrow in the image denotes which of the following muscles? So let us label this all muscle first of all. This one is triceps brachii. This one is brachioradialis. This one is extensor carpi radialis longus. This one is extensor carpi radialis brevis. This one is extensor digitorum. This one is extensor digiti minimi. This one is extensor carpi ulnaris. This one is extensor pollicis longus and this one is extensor pollicis brevis. This is known as lateral condyle of humerus. So the muscle marked here is extensor carpi radialis longus in this image. So the answer here is A. The next question is, what is the nerve supply of the structure marked in the image below? This structure is known as second lumbrical, which is supplied by median nerve. So the answer here is B, median nerve. The next question is, nerve supply of the area marked by the arrow in the image is. So this dermatome is actually the extensor compartment. That is supplied by radial nerve. So the answer here is A, radial nerve. The next question is, cholecystovena cava line separates which of the following? Completely straightforward and clear cut question. The answer here is, it separates right and left lobe of the liver. The next question is, which of the following is false about skin? Dermis is derived from ectoderm. This one is false statement. Dermis is derived from actually mesoderm. Skin accounts for 15% of total body weight. This one is true. Epidermis is derived from ectoderm. This one is true. Dermis is made up of type 1 and type 3 collagen. This one is also true. So the answer here is A. Dermis is derived from actually mesoderm. The next question is, which of the following structures are derived from the aponeurosis of the external oblique muscle except? So let us see the options. Pectineal ligament, yes, it is derived from the aponeurosis of external oblique muscle. Inguinal ligament, yes. Lacunar ligament, yes. Linea semilunaris is not the derivative of aponeurosis of the external oblique muscle. It is actually derived from the aponeurosis of internal oblique muscle. So the answer here is D. The next question is, which of the following lobes of the prostate forms the uvula vesicae? So factual and straightforward question. Median lobe of prostate forms uvula vesicae. So the answer here is C. The next question is, foot drop is caused by damage to. So foot drop is caused by damage to the common peroneal nerve. The next question is, which of the following is true regarding D. quervens tenosynovitis? So we have to find the right statement. So let us see the statements one by one. The first statement is, fingers are held in mild extension. This one is false. Fingers are actually held in flexion. It affects abductor pollicis longus and extensor pollicis brevis. This one is completely true statement. The next statement is, most commonly involved is index finger. This one is no, because thumb is the most commonly involved in D. quervens tenosynovitis. And the last statement is, treatment is surgery. No, it is actually the medically treated condition. Most of the cases are treated only medically, don't require surgery. So the answer here is option number B. It affects abductor pollicis longus and extensor pollicis brevis. The next question is, identify the structure marked B in the image given below. So let us first of all label these all four alphabets. There is corpus callosum, the B is fornix, the C is posterior pituitary gland, and the D is cerebellum. So the answer here is C, fornix. The next question is, first pharyngeal arch gives rise to all except. So first of all, let us discuss the derivatives of first pharyngeal arch. Muscles of mastication, mylohyoid, anterior belly of digastric, tensor tympani, tensor veli palatini, and anterior 2/3 of tongue. So medial pterygoids, yes. Levator veli palatini, no. It is not the derivative of first pharyngeal arch. Lateral pterygoid, Yes, because it is also the muscle of mastication. And tensor veli palatini? Yes. So the answer here is option number B. So with this, we complete our recall session. So thank you so much for watching and see you in the next one.